All right. Thanks, Commissioner. I had a little material here, but you cut into my time, so. So much for that. No, I'm glad you're here. You covered about half my presentation, which is good. It sounds more credible from you. They know me. How many of you were here last year? Thank you for coming back. This is a great turnout. But, you know, they did put me last on the program because if we got short on time, it was like, Rob can just move on. So let's see. I've already pushed some slides, and I don't even know what am I doing here. Hold on. How'd this go here? Can you get me back to? Can you do it? Can you get me back to the slide? There we go. Okay. How'd that do that? How'd you like that one? Okay. We've talked about individuals. We've talked about markets. We've talked about employers, and my focus. You know, being a chamber-based seminar, that we did want this to be focused on employers, but a lot of good information. I thought you'd enjoy my cartoon here. All right, I know you've been sitting for a while, so this is group optional. How about this? I'm going to have you you have your pads. Everybody's got everybody looks so efficient out there with your little pads and everything. But I know you want to stand up. So if you're physically able, I'd like for you to stand up and have your pad and pen in hand. All right, last year, if you were here, you remember I gave you a test. Well, we're going to do it again. If you remember well, you may not know this, but back in July, LIMRA, which is a national marketing research organization, asked over 2,000 Americans 10 true or false questions, and who's standing, there we go, only 1 in 10 Americans demonstrated a high level of knowledge about health insurance. 8 in 10 consumers failed the test. 14% understand how the exchanges will work, and only 1 in 10 consumers got at least 7 correct. So, are you ready? These are true, false, and you can number your little pad 1 to 10. You ready for the first question? I don't have these up here, so you're going to have to, this is mentally challenging in the fact that you're going to have to listen. Number 1, a PPO, Preferred Provider Organization, is a health plan that contracts with doctors, hospitals, and other health plan providers to offer medical services to its members. True, false? I'm going to move quick. 2, HMOs, health maintenance organizations, are a type of fee-for-service health plan. 3, the deductible is the amount you must pay out of your own pocket for health care for each visit before the insurance company or health plan pays the rest of the cost. If you need me to repeat one of these, I can. Let me know. Number 4, again, true, false. A health insurance plan with guaranteed issue means that an individual cannot be denied coverage because of current or past health status. Number 5, a health plan's drug formulary excludes non-preferred drugs. Our ProCare RX people down here know the answer to that. Number 6, a health insurance plan with a higher premium and lower deductible means you would pay less on a monthly basis and more out of pocket. True or false? Let me read that again. A health insurance plan with a higher premium and lower deductible means you would pay less on a monthly basis and more out of pocket. Number 7, a person's out-of-pocket limit can include coinsurance but not copays. Number 8, a primary care provider, or PCP, can be an internist, pediatrician, or a nurse practitioner. Number 9, reasonable and customary fees are the charges doctors bill insurance companies or health plans for their services. And number 10, federal law requires employers to offer health insurance to their employees. All right, you ready? Which one? 7. Number 7, a person's out-of-pocket limit can include coinsurance but not copays. All right, anybody else need any repeat? 10. Federal law requires employers to offer health insurance to their employees. Right. Number 1. Y'all don't really want to hear my presentation today, do you? A PPO, Preferred Provider Organization, is a health plan that contracts with doctors, hospitals, and other health care providers to offer medical services to its members. If I do this in the future, I'll put them on the slide. All right, you ready? Number 1, true. 2, false. 3, false. 4, true. 5, false. 6, false. 7, true. 8, true. 9, false. And 10 is false. All right, how'd you do? If you would just come up here and line up and tell everybody how you did. We should be through by 3:45. Well, you look at your results, and then you compare it to this slide. I can't take questions right now. That's right. Good point. Yeah, that's the commissioner's test to become a navigator. Yes, no. Thank you, Jeff Fishback. He's always making me look good. Yeah. All right, we know big change is ahead. Change can be scary, but it's also a time of opportunity. You know, back in July when we were all getting together and having barbecues and family get-togethers and a couple of days off, the administration dropped the bomb that they weren't going to fully implement health care reform. So, and then a few days later, they quietly released a 606-page rule that spelled out other delays. So here are the delays that you've seen. The reason I put this slide up here is because there's 32 other major provisions that aren't delayed that you need to be thinking about. Now, I've always liked is it the David Letterman's top 10? I've always wanted a top 10, so I'm like, well, okay, I'm going to do it. So I titled this one, 10 Reasons for Employers to Keep Their Affordable Care Act Guard Up. So these are things that I think that maybe you may not have even heard about, and I don't want to rehash everything that's been talked about today because our speakers have done an outstanding job of giving you a lot of information, right? So let's take the first one, plan fees and taxes, all right? Let me ask you this question. Do you know if the taxes and fees that are built, they're part of the Affordable Care Act, do you know if they're going to be, or if they're built into your rates, in your premium rates, or are you going to be billed for them? Do you know the answer to that question? And as an employer, are you going to pass these fees and taxes on to your employees, or are you going to pay for them separately as a company expense? This is a busy slide. But when the Affordable Care Act was signed into law, the coverage provisions were expected to cost $900 billion. That's been, I think, adjusted to $2.7 trillion. It's some goofy number, okay? But it's supposed to be paid for. All this is supposed to be paid for with fees and taxes on individuals and businesses, all right? So let's play a game again. You don't have to stand up. It did feel good to stand up, didn't it? All right. Write down how many new taxes and fees are included in the Affordable Care Act. All right? Just write down the number. Anybody get 18? 18. So the 10-year revenue for those 18 taxes is supposed to raise $836 billion. Okay? Now, I threw this tanning tax up here for a reason, because I had somebody come up to me the other day and said, you know, you look kind of pale. Are you okay? And I just told him, I said, I'm not paying the 10% excise tax to go to my tanning bed anymore. So it's just I just refuse to do it. So I'm going to look a little whiter from now on. But the main thing I want you to get across as far as the taxes is the fact that you've got two good handouts in your packet about taxes. Rushton and Company put together a good piece, and you should look at that. But let's focus on one here. The Cadillac tax is one of the most significant and controversial provisions of the Affordable Care Act. It was supposed to slow growing costs and finance expanded coverage. The ACA imposes an excise tax on high-cost health plans to take effect in 2018. And it's called the Cadillac tax because it targets so-called Cadillac health plans that provide workers the most generous level of benefits. Okay, so the tax doesn't take effect for 4 years, and employers are already scaling back benefits so that they don't have to pay this tax. The tax was supposed to generate $32 billion in revenue. Oops. Next. All right, compliance. This is number 2 on the top 10 list. Again, these aren't in any order, but I want you to understand this isn't talked about very much. But what do you do to stay up to date on changes in legislation, and what sources do you rely on for accurate and timely information? Now, while health insurance carriers assume some responsibility for fully insured plans, there are compliance burdens for all size employers too. There's probably a webinar that I could do every day, and the other people that are in business with me in this industry know that. I mean, it's just amazing, all the information, and it's good information. But there's a lot of emphasis about compliance, and I don't know that you're getting that information. So I want you to understand that the Affordable Care Act has a provision that's going to allow the IRS and the Department of Labor to hire additional 20,000 to 30,000 auditors for health care reform, to audit you. I participated in a webinar recently where there was an insurance broker out of California who has 3 audits going on right now. Anybody here ever had a DOL audit? Not fun, are they? I'm telling you, they can last up to 5 years before being settled and finalized. And if there's any bankers in the room, just ask them. If the auditors come in, they're going to find something, all right? Let's look at, we're in the process, I just want to let you know, of preparing a chart for our clients that's going to do a summary of the basic federal notice and disclosure requirements. I carry that blue notebook around because it's just so much information. And my retention level is not as good as some. But look at this compliance chart. Right now, the chart that we're compiling is 15 pages. So, again, using your little pad, how many compliance notices do you think that you're responsible for as an employer that you have to share with your employees? Some of it you've had to be doing, some of it you're going to be doing, some of it you're going to be doing after January 1. The answer is 42. So I've listed some of them here. How are you going to keep up with that? All right, let's move on to number 3, exchange and marketplace notice. Again, the commissioner did a good job of outlining this. We tried, as a service to our clients, to provide the sample notices completed, sample letter that they could provide their employees. How many of you provided those notices? They're due October 1. How many? Have you already distributed those? Are you getting a lot of questions? It's just clear as mud, right? All right. I do want to point out that on September the 11th, in relation to the exchanges, the DOL clarified that the law does not specifically include a fine or penalty for employers who fail to comply with the exchange notice requirement. That does not mean you don't have to do it. That just means you won't be fined if you don't do it. I don't know what they do to you if they can't find you. Take you out on the square or do something else, I don't know. All right, shop exchanges. I think this was hit on a little bit. I think the main thing I want you to get out of this is that in 2015, the shop exchanges should begin offering a variety of plans with multiple carriers. We don't really know. But, you know, as a small business owner, like many of you, we're taking a wait-and-see attitude on that. I do think it's important for you to understand, and I don't recall if the commissioner mentioned this, but the plans that are in the exchange are limited plans, limited networks, okay? And you may be able to get a better plan outside of the exchange. So don't feel like when you're counseling your employees or asking your questions, they're going to have options outside the exchange that may be better than what's in the exchange. So it's you know, I see Jeff Fishback sitting down here with Purchasing Alliance. I know they're in the process of, or they're going to have a private exchange, and you heard Rich mention that with the Walgreens and some of the others, and they're in the process of putting that together. And you never know, you may see something that could be tied in with a private exchange up here. But I do think it's important to remember that old adage, you get what you pay for. And that's going to be really applicable to, don't think that these plans that are on the exchange are going to be comprehensive plans, go to any doctor you want to. You're not going to be able to go out of network. You're not going to be able to go out of state. You're going to have you're going to be lined up with everybody else trying to get in to see the doctor. So you need to take that into account when you're thinking about this. Let's look at number 4. Oh, shoot. Okay. May cut this from the top 10 to 5. Application for advanced premium credits. Let me just tell you, if you haven't heard about this, okay, you're required, as an employer, you're required to complete a 12-page form for every employee that you have that goes and applies for a subsidy on the exchange. Okay? So who in your office is going to complete that form? Number 5, counting period for employer mandate. I'm not going to spend a lot of time on this. This really is more applicable to full-time employers with more than 50 employees, but that's something that you need to know more about. Here's, just to try to get through this, I want to make sure that this doesn't, again, apply to everybody in the room, but you can look at this slide. You're going to have to keep up with these hours. You know, we've been visited as insurance brokers by a lot of the payroll companies who are touting their software and the ability to be able to keep up with seasonal employees and part-time employees and how many hours they're working and things like that. You know, this is going to be very important. If your payroll system doesn't do that, you need to get with your CPA or your payroll vendor and find out how this is going to happen. But it is, it's a difficult calculation, and that's one of the things that, you know, I can do a lot, but I'm not doing that. All right. Many employers are going to become 49ers and 29ers. Thought that was kind of cute. So that's pretty self-explanatory, right? All right, number 6, a new reason to quit. I think the commissioner mentioned this. Under Affordable Care Act, insurers are prohibited from denying coverage to those with pre-existing conditions, but they are allowed to charge more based on age and tobacco use, and they can charge a smoker a surcharge of up to 50%. Number 7, did you know this? That pediatric dental and vision coverage is required in all plans. Okay? So you can buy the pediatric dental from a standalone dental carrier, or it can be packaged with medical coverage in or out of the exchange. We're being told pediatric vision care will be embedded in the medical plan. All right, I'm just hitting the high spots here. I want to be able to get into our questions. Number 8, HIPAA and high-tech compliance. Everybody aware that there's changes with HIPAA compliance, and all that's the due date is September the 23rd. So you need to be aware of that if you need to be brought up to speed. I like the little cartoon there. You know, this is one that came out on Friday, on September 13th. I love how they release things on Friday afternoon about 4:45. But the DOL, the Treasury, and Health and Human Services provided guidance on the application of certain provisions of the Federal Affordable Care Act in relation to health reimbursement arrangements, flexible spending accounts, and EAPs. Bottom line, standalone health reimbursement arrangements are out. Okay, so more details are coming on that. And in true government fashion, there's like 50 provisions you have to read through to see if your health reimbursement arrangement is applicable. So enjoy that. Number 10, questions to consider and other points to consider. Let's look at these questions. What is your mix of full and part-time employees? Could an adjustment of employee status reduce your penalty exposure? Could the adjustment of premium subsidies to employees versus dependents make a difference? If you provide coverage today, how does the cost of that coverage compare to your total penalty exposure? What are the reasons why the employer provides coverage today, and has the employer considered all options, including non-monetary concerns? Once you understand your philosophy going forward from today, with all the information you've gathered and gotten from here, what's your next step to accomplish your goal, and what do you want to do for you and your company? Some other points to consider. There are no penalties or employer responsibility requirements now, yet most employers offer coverage today. I think it's a very important point for you to remember. Penalties may increase over time as more employers choose to pay penalties rather than provide coverage. But please understand, penalties do not fully offset coverage costs in the exchange, adding incentive for increases in penalty amounts. And as an employer, if you pay the penalty, you're able to it's a tax deductible amount for you now when you pay your benefit, you provide benefits. That penalty amount is not tax deductible. If an employer increases salary to make up for lost benefits, employer FICA tax obligations will also increase. So let me ask you these questions. Is your total compensation package aligned with your company goals, and do your employees understand and value the benefits that you offer? These last 3 points to consider. If employees choose to remain uninsured rather than seek coverage, increased absenteeism may result, and your workers' comp cost may go up that are what for actually non-work-related health costs. Employers who offer coverage rarely ever see a 100% take-up rate, but please understand, employers who fail to offer coverage pay penalties for 100% of their eligible workers. So think about this too. Competitors may seek an advantage by offering coverage if you're not, and you may have a public relations backlash for not offering coverage. Kind of like this one too. That's why I emphasize compliance. You know, this stuff is complicated, and that's why you need help from experienced, trusted, local insurance agents. No. I put on here, you need advisors. I'm talking about your CPAs, your attorneys, your health insurance broker. Did I say that? All right, let's wrap this up so we can get into the questions. You know, it's easy to get wrapped around all the details of healthcare reform, the politics of it, and miss why you as an employer provide benefits. I think this summary statement reminds us of why you provide benefits to your employees. Read along with me. Providing affordable health care is a key to a company's ability to provide a competitive reward package and to succeed long-term in supporting their employee value proposition and meeting attraction and retention goals. We can talk about all these provisions and law and everything, but this is the meat of what we do. Okay, and this is what you do. This helps you accomplish your goals, to make a profit, to be a viable business. Right? We all agree on this? Let's not forget it. One last slide here. I want to make sure that I think these have been referenced. I do want to mention the unum.com healthcare reform. Is Caitlin Fraser still here? Caitlin, stand up. Caitlin's with Unum. In your packets, that 44-page booklet, this thing is really a great piece that Unum's put together. And she and her company put these and made them available to us. I don't know if you've opened this thing up, but isn't that great? It gives you the timeline and everything. I have this, I took this out and put it over it's on my mirror. And so when I'm shaving in the morning, I can look at that. I've cut myself so many times studying that chart. Maybe it's because I get all worked up. Thank you very much for your time. I know it's been a long morning, but I hope you found this very interesting. And thank you again for coming. We're going to see how everything plays out. October 1, we don't know. We're going to stay in the loop. And if we need to do another one of these in 4 months, 6 months, we're going to do it. Okay, so stay tuned. And I'm going to turn it over to Dr. David Miller to moderate our panel. Thank you very much.